Hello everyone, welcome to my YouTube channel Easy Nursing Lectures. So today's next topic is ruptured uterus. So what do you mean by ruptured uterus? As you can see in this picture, this is the uterus of the mother. Okay, and there is discontinuity here. So this discontinuity is what the uterus has been ruptured and the baby's head is getting exposed. So any disruption in the continuity of all the layers of the uterus. Now what are all the layers of the uterus? That is endometrium, myometrium and serosa. Okay, so all the three layers are getting ruptured. Okay, any time beyond 28 weeks of pregnancy. So the mother has completed 28 weeks of pregnancy. After that, there is a disruption in the continuity of all the layers of the uterus. So all the layers, that means endometrium, myometrium and serosa, has been ruptured after 28 weeks of pregnancy. Then only that condition is called as rupture of uterus. Now, so a small rupture to the wall of the uterus, a small rupture. Okay, so this is the uterus and here there is a small rupture. Every month is called as perforation. Okay, in early months, so in early months, that means before 28 weeks of pregnancy, if there is a small rupture, it may be called as perforation. Understood? Okay, so due to an instrument or any hydatiform mole, this may happen. Due to any instrument or hydatiform mole, this perforation may happen. But after 28 weeks of pregnancy, when all the layers of the uterus get ruptured, that is called as rupture of the uterus. So now every time you have to remember two terms when it comes to the rupture of the uterus, that is uterine rupture and uterine dehiscence. So what is the difference between the two? Okay, so we have seen uterine rupture. Uterine rupture is what all the three layers are getting disrupted or discontinued. But what is uterine dehiscence? So in this picture you will be it will be easy for you to remember what is uterine rupture and uterine dehiscence. So the first picture is all the layers are broken. Okay, the baby's head is completely exposed to the external environment. So this is the baby's head, so completely exposed. But here you can see in this picture that all the layers are not completely broken. Only two layers, that is endometrium and myometrium, are broken, but the serosa layer, okay, serosa layer is intact. So the head of the baby is not exposed directly. So that is the difference between the uterine rupture and uterine dehiscence. I hope you understood by this picture. So next we will see that rupture of uterus can be seen in which conditions. Okay, so first, when we completed the topic, that is obstructed labor. So when the labor is obstructed for a longer time, so what will happen? We have seen in the complication that the uterus may rupture. So that in obstructed labor we can see this case. The next is scar rupture. Scar rupture means a pregnant lady who was previously pregnant and she had a previous C-section. So that scar will be there. So because of the pressure, that scar may open up. Okay, previous C-section scar may rupture. So this may cause rupture of the uterus. Next is injudicious administration of the oxytocin. So oxytocin, it does what? It induces the labor. But when you are using it injudiciously, that means you don't know the amount or you don't know the quantity, how much to administer, or you are administering in a wrong patient, okay, without any information. So that may cause rupture of the uterus. Next is use of prostaglandin. So when we induce an abortion, okay, while induction of an abortion we use prostaglandin. So that time rupture of uterus may occur. Then next is fall or blow on the abdomen. If the mother is fallen down or any blow, any trauma has happened on the abdomen, then the uterus may rupture. Next we'll see the signs of the uterine rupture. So the very first common sign is fetal bradycardia. So fetal heart rate will be completely low. followed by absent heart sound. So the heart sound may not be felt also. So fetal bradycardia followed by absent heart sounds. Next is maternal tachycardia. So fetal bradycardia opposite maternal tachycardia. Mother will be in shock. So what happens in shock is tachycardia and mother will go in hypotension. Okay, next is uterine contraction stops suddenly. So suddenly the uterine contraction will be stop, because of that the fetal distress may occur, fetal heart sounds will not be able to hear. Then what will happen per abdominally? So per abdominally you will feel the tenderness, okay, distension will be there, fetal parts will be palpable because the endometrium, myometrium and serosa has been broken down. That's why you can feel the fetal parts. Next is, we have seen fetal heart sounds will be absent. Then uterus and fetus felt. Then the uterus and the fetus will be felt separately when you do per abdominal examination. Next is vaginal examination. So vaginal examination, so you will feel the vagina is hot and dry because mother is completely dehydrated and exhausted. So next is the recession of the presenting part, loss of station. So when the baby comes down normally in normal labor, but here what will happen, because of the rupture of the uterus, the recession of the presenting part is not happening, means the baby is not coming down, the recession means baby is coming up, and the station, which the station is there, +3 +2 +1 -1 -2, so those stations are not coming down, baby is going up. Okay, next is vaginal bleeding. Okay, bleeding may occur and hematuria. What will be the management of the rupture of uterus? That is, emergency management में what will happen is increase mortality and morbidity rate, because it is an emergency.